One of the more unique things about Reasons Eating Disorder Center is we have all the available levels of care under one program roof. We offer inpatient treatment, residential care, as well as partial hospitalization and intensive outpatient. Inpatient care really is focused on stabilization, whether it's stabilization of mood, stabilization of behaviors, medical stabilization, nutritional stabilization and normalization, as well as affect regulation, especially when it comes to eating disorders, knowing the rates of comorbidity with other psychiatric illnesses. The other real benefit of inpatient treatment is that in a 24-hour setting, we have not only 24-hour nursing care and monitoring, but patients have daily contact with a psychiatrist, patients have 4 individual therapy sessions a week, and all of that, in addition to the really intensive group therapy, allows for a much more intensive setting where we can stabilize patients who need much more acute care as well as that level of intensive care. Our residential program is located in a house, and we've designed it to be very much like a home-like environment. And other than just sort of being more comfortable than other kinds of settings, the intention is that we bring our therapeutic focus of exposure and response prevention into a setting where we have many, many more opportunities from the moment that a patient walks in to engage them in some level of exposure. Really on a minute-by-minute basis in a residential setting with all of the potential triggers that can exist for any of us when we're at home, we can really replicate that fairly well because we're in a house with a normal kitchen and there aren't locks and there's no artificiality in that way. So especially for a program that's based in exposure and response prevention, it allows us to do much more meaningful exposures with our patients that come very close to what they might be experiencing in their daily lives. Both our partial hospitalization program, which is an 8-hour-a-day program, and our intensive outpatient program, which is a 4-hour-a-day program, are designed to help patients either transition from a higher level of care if they're coming to us from residential or inpatient and continue to practice the skills that they might have learned so that they can eventually return back to their normal lives, or to provide patients who might need more support than they're getting in either their regular lives or just in outpatient treatment. The conversations in partial and IOP are really always about what do you need to get back to doing the things that you want to be doing or the things that you were doing before. Those are the things that can really help anybody who's really struggling with an eating disorder reconnect to whatever their sense of purpose or meaning in life might be. That's eventually what leads to recovery. Some of our patients may want to stay within the Reasons programs, but are not from the area. So for those patients who wish to attend our PHP or IOP programs, we offer independent living housing. So we can provide them with housing, and it also allows them to continue in our PHP and IOP programs, sometimes staying with their same therapist, but always with an eye towards better continuity of care. If you want to learn more, go to reasonsedc.com.